So I will talk in a couple of minutes here about the access of new oncology drugs, a European perspective. We've done this exercise a couple of times before in Europe and around the world. In total, we've looked at it in 45 countries. I collaborate with Professor Bengt Jönsson at Stockholm School of Economics. This study that I present, most of the data come from a collaboration or a project supported by the FPA, the European Federation of Pharmaceutical Industries. But I'll show you some other data that comes from out of a EU project, UNICE, and also that comes out of a project we've running here in Stockholm for Stockholm County. So let's see, this is probably, okay. Nothing happened. Isn't this one the progress one, or should I go down?
You can use
the
mouse or that one. Yeah. Use the mouse. You can click that on the next slide.
Okay. First, this illustrates the, let's say, costs for cancer drugs over a 10-year period, and basically the cost of cancer drugs have increased about fivefold over that time period. The bottom part of these bars illustrate drugs that were approved in 98 or before, and you can see that they tend to grow substantially also over time. The top parts of these bars illustrate first drugs approved in 99 until 2002, and the green part is 2003 to 2005, and these are the most recent drugs. So there has been about a fivefold increase in drugs, drug costs. So. We looked into different countries, and actually what I'm showing here is an extract from a report that will be fully available around November time. And here we pulled out a couple of countries. Out of 27 countries, we took a closer look at Austria. E13 here represents the average of European usage from Western Europe, and also where we have got solid sales statistics, because sales statistics are not really good in Greece, Portugal, and Ireland. So I picked out Austria, I picked out France, Hungary, Spain, Switzerland, and the UK. And Austria is, let's say, a high spender compared with the European average, but France is even higher, and we can perhaps discuss why France has got such a high expenditure on cancer drugs, but a lot of it relates to the national cancer plan that Jacques Chirac initiated in the early 2000s and got in place in 2004. Some of the newer member states in eastern part of Europe, like Poland and also Hungary, are spending at significantly lower level than the average European spending. Spain and Switzerland are using a similar amount of money on cancer drugs. Spain used to be quite a rapid adopter of new drugs in the early parts of this century, but I believe it, perhaps due to economical restraints within the Spanish healthcare system, maybe someone would like to comment on that, but sort of the increase has not been as rapid when it comes to spending in Spain as some 5 years ago. UK is on the low side. In 2007, we made the same observations in 2004 and 2005, and still UK tends to spend less money on cancer drugs, especially on the newer ones, if we compare this part with the French part of the bar. I just pulled out one slide which I think illustrates perhaps a good case and perhaps is of interest for you in the media. This is trastuzumab Herceptin, and here it's not in money, it's actually in milligram per case. And what we can see here, I pulled out France, Sweden, and UK. First, we can see that the first years after the drug was actually approved in 2000, but there was some use before in some European countries due to a Swiss approval, and you could get it on license, etc. But you can see that Sweden and France had about the same usage until 2005. The reason why the curves then start go up here is that there came adjuvant data in breast cancer, so Herceptin got much more widely used in breast cancer, not only in metastatic patients, but also in patients in the adjuvant setting. And if you look at the UK numbers, they have been about half the usage until this point of time, where you can see a similar rise in the UK usage. The reason why I bring this up is, first of all, with trastuzumab, Herceptin, UK tend now to be at a level that is relatively close to the average European level. If we then look on the impact in the UK of what NICE have done in appraisals, their first appraisal came at quite early, around this point of time. It really didn't have much of an impact on the usage of trastuzumab in the metastatic setting. So UK was all through until the end of 2005 on a similar level as about half the level as the rest of Europe. Here something happened. Well, it was not a nice appraisal because that came at this point. So I think the first part of this curve really represents a media debate. So I just illustrate that drugs can be quite media-driven, and I think that is perhaps not to the advantage of patients overall, and it's perhaps not to the advantage of sort of scientific progress in all cases. But this Herceptin curve illustrates several things, and we can wonder why does Sweden not go to the French level? Well, this is one of the last slides I have. It's because Sweden, we still see this is healthcare regions, and from another project that the average usage in Sweden, the red part here, is at one level, and then the usage in some of the Swedish healthcare regions is about twice as high as in other healthcare regions. So we see sort of intra-country variations as well as inter-country variations in the use of cancer drugs. So, just to put this in perspective, because there has been a lot of focus on the cost of cancer drugs, and this is from David Kayat, who was a key person in the French cancer plan, a presentation last year where he showed that in France, actually cancer takes about 1 out of 4 death, but 40% of all what we call premature death, individuals dying before the age of 65 actually die out of cancer. So it's a huge burden when it comes to healthcare. If we look at the French system, they allocate about 11% in the public system to cancer, and out of the total healthcare budget, about 0.8% goes to neoplastic drugs, to cancer drugs. And if we look just solely on the most recent drugs, it's about 0.5% of the total healthcare budget. Of course, then the key question comes, and that we can have a long discussion about, does the access to drugs impact survival? Well, we who've been working with this for a number of years, we believe that that's a fact, and I think there is support in several studies coming out right now. I know that there are people who totally disagree with this. Professor Michelle Coleman, for example, in the UK, states that there is no relation on access or different levels of access and outcome. I think this is a discussion that should continue. We see gaps, and we should sort of we need to take some kind of standpoint if we should mind the gap or if we should not mind the gap. Thank you.